What if the medicines you take stopped working? That's a reality for a lot of people as superbugs are making medications like antibiotics ineffective. Antimicrobial resistance, or AMR, is when germs like bacteria and fungi defeat the drugs designed to kill them.
Everybody gets an infection now and then, and some of those infections are serious. And so when we're treating with an antibiotic that's no longer effective, several things can happen. Number one is it's going to take a lot longer to get better, but we might have actually more problems and more serious infections because we're not giving antibiotics that are really doing their job.
And this continues to be a public health threat, exasperated by the COVID-19 pandemic and the overprescribing of antibiotics.
And that's one of the problems that we have is when we give antibiotics that aren't needed, it gives the bacteria a chance to develop resistance, to get comfortable with that, and then to survive in the presence of antibiotics. So we need to be much more careful and wise about how we use antibiotics to preserve what we have. And part of the reason we are advocating testing is just so you know what you're treating. We want to make sure that we give the right antibiotic for the right dose at the right time. And to do that, we need to know what infection we're actually treating up front.
And since antibiotic resistant infections can occur anywhere from the backyard to the hospital, it's time to reconsider the approach to how and when we use antibiotics.
The best way to do this is to prevent infections in the first place. Wash your hands. During this time of year, make sure that you're cooking your food appropriately. And if you get a little cut, if you're working in the kitchen, cover it up. Make sure that you're not spreading any germs to anybody else in your household. So be proactive about that, and in that way we can avoid needing antibiotics in the first place. That will help us out.
If your doctor is considering prescribing an antibiotic, it's good to have an upfront talk with them to make sure you're getting the right treatment.
Ask your doctor if they've done the appropriate tests so they know what you're treating, and to get all of the information they need about the antibiotic they're going to be taking, how long they need to take it, if there's any side effects. So be proactive with your doctor, be your own health advocate. And in that way, we'll have a good conversation, and we'll make sure that when you're taking an antibiotic, it is the right one at the right dose. And you're starting all with the best diagnosis you can get by using the best diagnostic test.
You can find out more about antimicrobial resistance, or AMR, at the CDC website and learn about proper diagnostic testing at Cepheid.com. Bringing you the best of California, I'm David Wiley for California Life.